Hello, my name is Elizabeth Lee-Lewandrowski. I am from the Department of Pathology, Division of Clinical Laboratories and Molecular Medicine at the Massachusetts General Hospital and Harvard Medical School. I am also the Research Director for Invisible International. I am presenting this course today titled Measurement of High Sensitivity Troponin T in Patients with Early-Stage Lyme Disease, Possible Evidence for Subclinical Cardiac Involvement. As part of the Invisible International's Medical Education Initiative, this program, which includes a large library of free CMEs, is generously supported by the Monte Calvo Family Foundation. Dr. Kent Lee-Lewandrowski is my co-researcher on this published study. He will join me later on the Q&A session. The title of today's presentation is Measurement of High Sensitivity Troponin T in Patients with Early-Stage Lyme Disease, Possible Evidence for Subclinical Cardiac Involvement. Objectives: 1. Review current understanding of cardiac involvement in early Lyme disease. 2. Describe measurement of high sensitivity troponin T in early Lyme disease. 3. Review causes for an elevated high sensitivity troponin T in the absence of acute coronary syndrome. Statement of conflict. All authors have no conflict of interest to declare. This slide shows the clinical features of Lyme disease from CDC. Lyme disease presenting symptoms vary and overlap with other disorders. The classic EM rash is not always present. Cardiac involvement occurs in 1% of the cases. This chart shows the relative frequency of clinical features among confirmed cases in the United States from 2008 to 2017. 2% has meningitis, 71% has EM rash, 4% has neuropathy, 9% has facial palsy, 1% has carditis, and 28% has arthritis. Cardiac involvement in Lyme disease can take many forms. AV nodule block, most commonly seen, myocarditis, pericarditis, endocarditis, cardiomyopathy. And this photo shows the spiral key is embedded in myocardium. This picture is from CDC. Clinical utility of troponin blood testing. Troponin I and T leak from damaged myocytes following cardiac injury. Troponin testing is mostly commonly used to evaluate patients with acute coronary syndromes. Historically, there have been case reports of elevated troponin levels in patients with Lyme disease using older, less sensitive troponin assays. The new high-sensitivity troponin T can detect the troponin at much lower levels than earlier troponin assays. What is a normal HSTNT? Current consensus is to report the 99th percentile of normal reference population. Therefore, 1% of normal subjects will exceed this level. In 2022, we published a study on the Annals Clinical and Laboratory Science. Study abstract. Study background. In patients with early Lyme disease, cardiac involvement is known to occur in approximately 1% of the patients, according to the CDC. Study methods. We measured high-sensitive troponin T in 41 patients with a well-characterized early Lyme disease to evaluate the possibility of subclinical cardiac involvement. Study results: 6 out of 41, which is 14.6% of patients, exhibited high-sensitive troponin T values above either the gender-specific or gender-neutral 99th percentile cutoff for a normal high-sensitive troponin T. One patient had a value greater than the cutoff used for acute myocardial infarction of 69.32 nanograms per liter. The cutoff is greater than 52 nanograms per liter. One other patient had a high-sensitivity troponin T of 22.9 nanograms per liter. At the Massachusetts General Hospital, we flag high-sensitive troponin T values for female greater than 10 nanograms per liter, for male greater than 15 nanograms per liter. What does this all mean? Based on the 99th percentile upper normal range, we would expect 1% of healthy subjects to have a result above this range. However, in this study, 14.6% had values above upper normal range of the 99th percentile, and one subject was above the cutoff of acute myocardial infarction. There are many causes for an elevated troponin T in the absence of an acute coronary event, including systemic inflammation. Other organ systems may also be involved in early Lyme disease. In 1996, one study studied a patient with early Lyme disease, found 40% had abnormal liver function tests. Therefore, it is not surprising to see the heart as an organ is involved in the early Lyme disease. Examples of conditions in which troponin T may be elevated: acute coronary syndrome, myocarditis, heart failure, chronic kidney disease, acute major illness, systemic inflammatory disorders, left ventricular hypertrophy, etc. In conclusion and recap, in our study has shown elevated levels of high-sensitivity troponin T are observed in 40.6% of patients with early Lyme disease in our study. There are many possible explanations for increased HSTNT values in different types of patients in the absence of acute cardiac damage. One explanation for our finding is that an acute systemic inflammatory response may result in the increased HSTNT. Nonetheless, our result raised the possibility that subclinical cardiac involvement may be more common in early Lyme disease than previously recognized. Limitations of this study: no ECG were performed, no post-treatment samples were tested. Therefore, further studies will be necessary to elucidate the significance of this finding. Thanks for attending my presentation.